every exam there will be at least 1 or 2 questions from this particular topic. Okay, so now I am starting. What is the difference between ulcerative colitis and Crohn's disease? Difference between ulcerative colitis and Crohn's disease. Okay, here this is Crohn's disease, here this is ulcerative colitis. Okay, so okay, so the Crohn's disease is segmental disease. And there is presence of skip lesions. Whereas ulcerative colitis is continuous disease and there is no skip lesion. Okay, then it is most common site of involvement is ileum followed by cecum or IC wall, cecum. Site is ileum. Here the most common site is rectum, which is almost always involved, followed by sigmoid colon, and it goes upwards continuously. Okay, now the next point is it is a full thickness disease. It is also known as transmural disease. Ulcerative colitis is superficial, involves mucosa, or maximum it goes to submucosa. Muscularis is spared. Okay, now the next point is development of ulcers. Here the ulcers are deep and here the ulcers are superficial or mucosal. Next, pseudo polyps are more common in, they are seen in Crohn's disease but are rarely seen. Here it is common. Okay, then in Crohn's disease, fibrosis or stricture formation is common. In ulcerative colitis, it is rare. Okay. Okay. Now, shortening of bowel occurs in both ulcerative colitis and Crohn's disease, but in Crohn's disease it occurs due to fibrosis, whereas in ulcerative colitis it occurs because of contraction of muscularis. Okay. Now, what all are the microscopic features? Now, depth of inflammation. Depth is already discussed, transmural. Here it is mucosal plus submucosal. Or non-cageating granulomas are seen in Crohn's disease, and there is infiltration of mononuclear cells. Whereas in ulcerative colitis there is non-specific acute or chronic inflammatory cells. In mucosa there is presence of patchy ulceration. Earliest sign is aphthous ulcer, and there is presence of normal mucosa in between, which gives appearance of cobblestoning or cobblestone appearance. Okay. Here it is hemorrhagic mucosa with ulceration. Okay. Now, what about submucosa? Submucosa here is widened in Crohn's disease due to edema and presence of lymphoid aggregates. Here it is normal or reduced in width. Okay. Fibrosis is seen in Crohn's disease and fibrosis is absent in ulcerative colitis. Fibrosis present, absent. Okay. Now, the next point is complications. Fistula is present, seen in up to 10% cases. Mainly the enterocutaneous fistula or enterovesical fistulas. Enterocutaneous, enterovesical, enterovaginal or internal fistulas, you can say. Internal or external fistulas. Here they are rare. Okay. Now the next point is malignancy. Malignancy we have already discussed. Colon cancer, Crohn's disease is similar to ulcerative colitis. Okay. Small intestine cancer, Crohn's disease is more, and small intestine cancer is seen more in Crohn's disease than in ulcerative colitis. Most common site is ileum. Okay. Now, cholangiocarcinoma, more seen in ulcerative colitis. Why? Because primary sclerosing cholangitis is more in ulcerative colitis. Okay. This is regarding malignancy. Now, fibrotic strictures. Now, fibrosis is more in Crohn's disease, stricture is more in Crohn's disease, fibrotic stricture is more in Crohn's disease, and toxic megacolon. Is rare in Crohn's disease and is more in ulcerative colitis. Okay. Now there are various important named radiological findings which are seen in Crohn's disease also or in ulcerative colitis also. I am giving a mnemonic for both of them to remember them. Now, there are named features in Crohn's disease. What is the mnemonic for them? String has CRF. We have discussed all of them in detail. Okay. So now it is string sign, or you can say string sign of Cantor, which is similar to hose pipe sign. Okay. Then C stands for creeping fat sign. Then there is comb sign. Okay. This R stands for raspberry thorn or rose thorn sign. And this F stands for fat halo sign. This can be easily remembered with this mnemonic string has CRF. Okay. Now, what is the named features in ulcerative colitis? Okay. So they can be remembered by mnemonic GPL stove collar button. Okay, this G stands for garden hose appearance or garden hose sign. Then pipe stem colon, lead pipe sign. These three are the names for ahostral colon. Now there is these four. This stove pipe sign also. These four are the name for ahostral colon: garden hose appearance, pipe stem colon, lead pipe sign, and stove pipe sign. Along with that, this is important. This hose pipe sign is seen in Crohn's disease, whereas the stove pipe sign or lead pipe sign is seen in ulcerative colitis. So they are a bit confusing. So you should remember the mnemonic. And this collar button ulcer seen in ulcerative colitis. Okay, so that is all about differences between the Crohn's disease and ulcerative colitis.